Good morning and welcome to this special pre-APHA webinar. I'm Paul Irwin, Dean and Professor in the School of Public Health here at UAB, and I want to welcome you to this seminar, a special seminar that is being provided by my friend and colleague, Dr. Pedro Más Bermejo. Let me provide a little bit of an introduction, and then we will proceed with the webinar. Dr. Pedro Más Bermejo is a physician with dual specialties in epidemiology and public health. He is emeritus research scientist at the Tropical Medicine Institute, known as Pedro Kouri. He is emeritus member of the Cuban Academy of Sciences and full professor of epidemiology and public health at the National School of Public Health in Cuba. Dr. Bermejo graduated from Central University in Cuba and trained in epidemiology. He did his PhD at Charles University in the Czech Republic. He then served in the Ministry of Public Health as National Director of Epidemiology and completed a fellowship at the Liverpool School of Tropical Medicine in the UK. His major academic appointments were General Director of the National Institute of Hygiene and Epidemiology in Cuba, the Pan American Health Organization as Sustainable Development and Environmental Health Advisor in Jamaica, and coordinator of Cuban Cochrane Center. He has served numerous times as an advisor for WHO, for PAHO, that's the Pan American Health Organization, and for WHO expert committees and the WHO Collaborating Center for Health and Housing. He has worked in epidemiology and a health advisor in many countries, including Ecuador, Mexico, Thailand, Costa Rica, Jamaica, and many more. Dr. Bermejo has published 5 books and more than 90 papers, primarily dealing with epidemiology and public health. He is an editorial board member of the Journal of Public Health Policy and is a member of the American Public Health Association. Since the Cuban response to COVID-19 pandemic began, he has been called by the country's government to coordinate an ad hoc group to carry out epidemiological research that will help in making informed decisions. I had the very good fortune of working with Dr. Bermejo on a manuscript a couple of years ago and have continued collaborating with him most recently when I was able to visit Cuba in the early part of this year. We had planned for Dr. Bermejo to be here at UAB in person and to travel with me to the APHA annual conference. Unfortunately, he was unable to receive a visa to be able to travel here. And so we are making this webinar available to you. He is joining us from the PAHO offices in Havana, Cuba. So without further ado, let me turn it over to Dr. Pedro Más Bermejo and welcome you virtually to UAB, Pedro. It's all yours.
Thank you very much for the introduction. I appreciate a lot the invitation for being involved to be here and to share with you some experience from Cuba. I am really very proud to be here sharing with you these ideas and results that we have. Well, I am going to start with this presentation. As you know, the time is not too long. I just put it in the main results, taking into account the Cuban vaccine from the production to clinical trials to widespread use. And these three ideas I'm going to combine during the presentation. And if you have some question, I'm totally open to answer. Well, this is first of all, I have to speak about the health system in Cuba because it's the place that we are working with the vaccine and the response to COVID-19. And we have different, the Minister of Health at the national level, we have a province or municipality level. In the national level, there are the National Hospital and the National Research Institute, and of course the university. Because in Cuba, the medicine university belongs to the Minister of Health. At the district health, that meaning provincial in our case, there are district hospital, health service, and training research place at that and the division, meaning at the we call here Consejos Populares, we have the health centers, it's primary health care mostly, and of course in the small village you have health workers, but then in our case, all the health workers in our village are doctors. All of them are interconnected to the national system, and it's a totally free the service, and it's a connection, meaning that you have if you need the resources for the national hospital, which will be used at the local place. This is one advantage that we had in the health and the promote the response to the outbreak. And this is one idea just to show you how the health system is in its process of innovation, because many things happened during the last year. And this is a circle, and you see the outside of the circle is political, historical, demographic, epidemiological, socioeconomic, cultural, and geographical. All the environment factors that are included for sure in the health system. And of course, there is a political, meaning health policy planning, and the health resources, the health needs, interventions that have to be done during the process of the health system. And of course, finally, we get the health that is more important for the system. So this processing of innovation, I have not time to explain in this occasion, but maybe another time I can do something to be more clear, because in one slide very difficult to explain. Well, this is a publication that I read many years ago in PNAS. It's in case between innovation, economic growth, and health. They said that the traditional views of health is a country guess is macroeconomic right, health improvement with follow. And the other point you can read is the reference there. And the other point is empirical evidence that some countries will low per capita growth, is our case. Domestic product have life expectancy comparable with those with that's our case with the expectancy of life. Now we have some approaching the public health that is changing because the current situation in the world. And talking now, this is the health system. Now I'm going to speak very short about the biotech industry in Cuba. The state is the main investor, The scientific and technical preparation of the training is in Cuban University of Excellence, and the significant investment in education and the training of Cuba resource of human resource and close relation is very important one. When I go in deeply with the presentation about the Cuban vaccine, is close relation between the health system and the health needs of the population, and this approach development primarily focus on the health needs of the population and the product of development substitute for imports and self-sufficient national demand and national health products. And the national market is the highest priority. Another point that is very important. And this industry, biotech industry, is a group of center, more than 15, or now it's growing up. It's maybe we have around 20 now. Completely, they made research, production, marketing, and after sales cycle. And this cycle is very important for the approach of this situation. And they have a synergy between research and development, free of any individual compromise. Each institute contributes with its strength and create new products and obtaining things that collaboration within and with the institution. It's a very important point because collaboration, we are working in the research center, we are working like a network. And gain in international competition in terms of quality, production, volume, cost, and knowledge. And collaboration with developing countries for us is a priority. The product that we have, I'm going to explain the vaccine, but there are many that we are produce and to share with developing. We'll see in the case of vaccine later. Well, this is a photo, a screen with most of the center of biotech thing, and we include the University of Habana on the left and the University of Medicine of Habana as well, and all of them are coordinated by Cuba Pharma. It's a national big enterprise that have is in charge of all these things. If you see the building there in the very good condition and very competitive. Well, I'm going to speak about the Cuban experience in immunization. Maybe some of you say, why? Because to start with the immunization campaign with COVID-19 is not like it's like, well, let's do it. We said this, and that is why I want to share you the experience of 55 years in immunization campaign. This is an article is published in 2018 in the Pan American Health Organization journal. This is in Spain, but you can find in English and Portuguese if you start it. I am talking about 55 years of immunization campaign. And this table is in the article, and it's a summary that the rate of incidence and mortality from vaccine of communicable disease and vaccination coverage prior the lancet of Cuban immunization program 55 years later by disease. On the right, you can see the disease, on the left, sorry, you can see the disease. The incidence, the first column, the second one is mortality. You see, the area is 20, but 100,000 population, and tetanus, polio, measles, rubella, and hepatitis. And at that time, the coverage is very, very low, very, very low. And of course, the mortality is very high. After 55 years, in 2015, you will see the incidence of this disease is zero, just 0.5 per 100,000, because this vaccine came after the problem with hepatitis B and mortality is zero. But you see how high is the coverage of the campaign, more than 95%, or some of them 100%, and you see in the hepatitis case, it's 99.9%. It's a Cuban vaccine, but now I am going to speak about it. This is just, I was looking for in one slide example how the health system and biotech industry works together. This is the incidence of tuberculosis. This is the incidence of Haemophilus influenza type B, hepatitis B, and meningococcal disease. You see, in the case of tuberculosis disease, BCG, that's the vaccine, we started producing Cuba, and see, it's not the Cuban vaccine, it's the national vaccine, but we produce in Cuba, and you see the incidence of tuberculosis. But in the case of the Haemophilus influenza type B, we developed a vaccine in Cuba, and it started, as you see, around 2000, 20 years ago, and you see what happened. The red line is the coverage of the vaccine, and the green line is the incidence of the influenza type. Hepatitis B is the same. Is the you see the situation of hepatitis B, the incidence in the green line, and the vaccine is a Cuban vaccine for hepatitis B that we are using for more than 25 years, and you see the outcomes. And the meningococcal disease, the same happens with the red line coverage, and we have a big peak. I remember that, and we don't have vaccine at that time, and see what happened. This is a summary that how the health system works with the biotech industry. They develop vaccines of drugs, and we have the opportunity and we have the challenge to introduce in the health system. Well, now I'm going to speak about clinical trials. A clinical trial, because this the slide before, the clinical trials was very important to us 25 years ago. And since that time, we have a regulatory authority for drugs and equipment, medical devices for the Republic of Cuba. The name is on the left, segment. And this is a building, it's a wonderful building that is elevated with all the regulatory authority. And this is in promoting a protection policy through a regulatory system. And to have the guarantee timely to access to products with quality, safety, efficacy, and truthful information for the rational use. And this is one thing that is very important. Well, what happened? Now I'm going to start with the COVID-19 vaccine, because it's the main point that I want to share with you. Okay, well, with the development of vaccine, we have a big challenge with data monitoring committee for the first Cuban vaccine. I have to check you. I have no time to explain that, but at the beginning when the pandemic started, the first question that we had is how it's possible to develop COVID vaccine, and 5 candidates appeared, 5. From these 5, we selected 2. It's COVID, it's Soberana and Abdala, meaning that all the outcomes I am going to present today is related with Abdala and Soberana, because the other vaccines are still in clinical trials. In this occasion, for this, we have a challenge of the data committee for the vaccine of COVID-19, and this thing appointment by the sponsor of these aims is the data monitoring committee. It's a new experience that we had during the COVID vaccine. It's independent, external, or separate committee. Well, how far the Cuban vaccine are happening? Now, let me explain in 2 minutes that when we started with the vaccines first, and the clinical trial then, and finally started with the vaccination campaign, many criticized appears, many opinions, not good opinions about the Cuban vaccine, and that is why we have to prepare a good clinical trial, a good evidence about the vaccine use later. And at that time, when we finished the clinical trial, we had experience to use the vaccine in Cuba. You see, Soberana vaccine was used in Italy, Nicaragua, and Venezuela, Iran, Belarus, and Sahrawi Republic, Arab Republic. And Abdala was used in Vietnam, Mexico. In Mexico is Abdala is one vaccine that they are using. Venezuela, Nicaragua, and some Caribbean islands. All of them we are following even the situation of the vaccination in those countries that they were using and still using the vaccine. Well, this is what happened is that because, well, we said, well, the situation is very difficult with the pandemic. We have no money to buy the vaccine, very expensive, and on the other side, because the embargo may be we have problems with to buy the vaccines, and we decided to start when the clinical trial is finished with 2 vaccines. I am telling you before, Cuba, Soberana, and Abdala. I have no time to explain how we do that, but maybe I will try to summarize everything, and maybe you, if you have some questions, I will try to answer. Well, we started with decided by the committee, on the scientific point of view, we decided to start with the vaccination in the old person, mainly the Cuban doctors first, the health workers then, and then people at risk, and then we prepare the campaign. And I put this example here because we're following all the time how these interventions continue, and then I put this because it's the good news that this vaccine, because the problem at that time with the people who received the vaccine against the children, because ethical issue and so on, but finally the same because the previous outcome decided to use for emergency use the Abdala vaccine for the pediatric population between 2 to 11 years. I think that it's one of the countries that started to use with the vaccine for children at the very beginning. And what about the widespread use? This is another problem because all of you remember that during the pandemic, the services are have very hard time with many things, and we decided to, because the primary health care that I mentioned before in summary, and the organization of the health system allows that we can start with this organization. And the other thing that we have to take in mind, or to took in mind at that time, is the cold chain survey, because you know that Cuba is a very hot country, and even the use was in May, June, August are the hottest month in the high temperature in the but we always have in mind quality, security, and efficiency. And this we started with the widespread use. And this is just a characteristic of the vaccine. It's a protein subunit vaccine. The active ingredient is the recombinant protein RBD, receptor binding domain. It's a technique that our research center knew very well that time that we started. This is the vaccine, and this is the schedule. See, it's the example of vaccine Abdala, 3 doses with the 0.5 milliliters, and the interval is 14, 28 days, and 1 month. The booster, because it's three doses, 14, 28, and then more. And after the third dose, we use the booster of the vaccine. Well, going to the future, it's a summary. There are many, and I would recommend to use some papers if you want to read and to be in depth in this knowledge. You can do it. Well, this is the one example. It's a study that we, because what happened? Let me explain to you. Because you see the curve is in this case incidence and death is the blue line or yes, and you see that because the situation of the outbreak, you have to do something, and you have the vaccine, you have the isolated center. We have many resources that we have to use it at that time, but finally we decide, well, we have to follow the health system strategy with the research, good research, and we were working together at the same time since the very beginning. And you see, this is the statistic week, and this is the incidence, the rate of incidence for the population. And yeah, I explained this incidence and this mortality. Sorry, there are some words writing in Spanish, but it's not difficult. And what happened that we started to the vaccination on May 12th. That is why the cold change I spoke before. And then at that time appears in Cuba the different strains, and was Omicron start in Cuba, and when we started the vaccination, we call health intervention because it's a vaccination and other epidemiological measures. And when we started, appears a peak, and when we finish, you see, I will show you later on, when we reach the peak here, the finish the end of the maximum intervention. It's a very big intervention, and the mortality and the incidence decrease. And then we use a booster in different situations according to the vaccination program. And this happened in the 80% of the population in Habana, more than 19 years age. And this intervention was on May, June, and 22nd of July. And we work with the FHC. And then this is one example. I will show you some. This is Cuba. What happened in Cuba? The red columns that you see here is the incidence of the disease, and the numbers that you have is the percentage of immunization. Remember that I spoke that we started with the intervention. If you see, we are going up with the vaccines and the disease going up as well. But when we reach a point, so this point, 38% percentage of the immunization, the number of cases, the incidence of the COVID-19 comes down and start to decrease. You see, it's yellow, and you see it's coverage, and this is red. Okay, and you see very clear here, but this is just in Cuba, meaning that the information in Cuba is too big, and that's we decided to refer the research, the slide that I showed you before, with Habana. It's the biggest of the city in more than 2 million inhabitants, and we decided to refer. But we came back with the Matanzas province. Matanzas province around 120 kilometers from Habana, but this is more than very famous for the beaches, the Varadero beaches in Matanzas. But if you see here, in the same happened with the vaccine in Matanzas. This is a study in Matanzas in 2021, and you see this is the coverage, and this is the incidence. 35%, meaning that around 30%, between 30 to 20%, the population, the incidence of the COVID-19 decrease. This is the point. But what happened is that we reached 1 million doses in a short period of time. Because it's not just the vaccination, it's the speed of the vaccination. It's one process, it's a real process, when we reach the 1 million doses of the vaccination in the population. Well, let's go see now what is it. This is the number of doses according to a schedule of age by age group. This is because remember there are 3 doses booster. And you see this million of doses. The blue is infant less than 2 years, and this is the less than 12 years, and this is the adults. And you see it's 8 million doses in the first shot, 7 million and something in the second. This is normal what happened in the immunization campaign, and 7 million and but less than the second. And what is one, just people that use one dose, very few people. This is the full scheme, and this is the first booster. It's the first booster, and this is what happens with the number of millions. We're talking about millions, and you might millions. How one system have the strength to do this kind of things in very short time. And this is the percentage is the same like this one, but it's the percentage of the pediatric, the from 12 to 18 years, and other plus than 19 years old, the same one. The first dose is the rate per 1,000. Sorry, it's a percentage in this case, but you see the percentage is very high. And if you compare with the other countries, I have no time to do that, or we can do it another time. You see that it's a high coverage of the completed scheme, meaning 90% of the. Well, this is the approach that we were working. I told you, it's published, doing research, and published and doing research, and then. This is a hard time for us, imagine, but we're preparing, we're working the campaign in the night, working in the research, taking information, processing information. This article is published in September last year in Lancet, Lancet review. It's the label. You have the metrics of the article, and this is a cohort study. But to evaluate the effectiveness in preventing severe disease, death for COVID-19 in the cohort study with the big design, because we were working with the population of Habana, but it's very hard. Just, I want to show you two things that you have in mind what we, this graphic that you have about. Is this is what happened in Cuba, the black line is what happened in Cuba during the campaign. The red is a prognostic that we are going to happen if nothing will do with the red. The blue is the middle, and is what happened, and the red is the best, meaning that we were better than the middle, because the Cuban approach, the response, and the campaign. Well, I have no time to explain this. It's available. You can read. There are many mentions, captured. We received a lot of. It was a hard time to publish this article. You know how hard is we had the 6 referee at the beginning, then one decided, no, I finished, but then come back and so on. But finally it's there, you can read it, and you can use, we are using now for the teaching like this. This is another article. I was in charge in contact with Professor Paul Irving, and one day we said, well, why don't we compare what happened? What is the response on Cuba and the United States? Imagine that this was in 2021, and you have the rate. This article has a lot of information about the response. I think that in the future, maybe we can compare with more details this response, because it's included vaccine, many things, and it was a very article. I am very happy to work with the Board and with UAB, and of course with the public health people in the United States, and it's a response is available and was told in the American Journal of Public Health. And this, because this is thanks to Professor Irving, because I have not the report. I was working with that report, but I was not the report in my hand, the final report. Because the situation with the people criticize the vaccine, using how we were using the vaccine, many things. We received here a big delegation in the United States, and very friendly people, but very strong to evaluate the situation with the Cuba vaccine. They had access to every place, primary health care, research institute, biotech center, places, because it was in September. In that moment wasn't so. In that moment, we have some places with using the vaccine, and they visit everything. They have access to every place, and they make a report supporting the Cuban vaccine. Very big report. It's reliable. Professor Paul Irving after report, and I am very happy. Not because they evaluate Cuba, because the scientific level of that people and how open they how when they have different opinions, we discuss the opinion very hard, but very professional group, and this was a good support for our vaccine in Cuba. I think that statistics was the results was very clear, but we need this, and the reporting journal, but we need this external evaluation group, nothing to do with you, and very high level person. And 45 minutes. And we are very happy, it's been happy. And also I am very happy again to be here to share with you this modest experience. And maybe in the future we have another time to have another type of presentation, because I am sure that scientists have to be joined in order. I spoke with the board before the conference. I told him that during the campaign we were in collaboration during the response to COVID-19. We have collaboration with Australia, with Mexico, with Thailand, with many countries through the webinar, and it's meaning that science have no borders, and the COVID-19 show us that the no borders is you need a new type of research, not a different conditions. That all. Thank you very much. I'm fully open to have the questions. And thank you again to all of us.
Thank you so much, Dr. Bermejo. I'm looking at the Q&A box, and right now we don't have any questions in the Q&A box. Let me sort of reiterate a couple of points that you made in your presentation that I think are really important to emphasize. First of all, your point that that Cuba's development of COVID vaccines didn't happen out of in a vacuum, or just with no history behind it. Cuba has a long history of success in developing vaccines and then getting those vaccines into people. So highly successful, long history of vaccine development. So that's one thing that I wanted to emphasize. The second thing that I wanted to emphasize is that the clinical trials that you described were actually carried out through the Cuban health system. And so you had all of the infrastructure of the family nurse doctor consultorio, you had the polyclinics, all of that infrastructure, and that served as the location, if you will, for the clinical trials for the vaccine, which in my way of thinking is absolutely brilliant to be able to do that because you were able to complete your clinical trials in a relatively much shorter period of time because you use the existing health system. So I wanted to emphasize those points. A couple of more comments to make. The American Journal of Public Health article that we did together, Dr. Bermejo, was actually led by an undergraduate student here at UAB, who is the lead author, and she is now completing her master's in public health at the University of Minnesota. Very, very proud of that. And then finally, to make the point of one of your last slides that you showed about the high-level U.S.-led delegation to assess the COVID vaccine experience in Cuba. One of those participants was UAB's very own Jeannie Marazzo, who at that time was head of infectious diseases here. And as people, I think, on this call will know, she has now been tapped to replace Anthony Fauci at the National Institutes of Allergy and Infectious Diseases of the NIH. So we're very proud of Dr. Marazzo's involvement in the assessment of COVID vaccines. Dr. Bermejo, while we're waiting a few more minutes to see if any questions pop up, what is next in terms of work, research regarding the COVID vaccines there, or the pandemic response there in Cuba? Anything that you want to comment on what is next?
We no. Since the response, the beginning of the response, 2021, we received here a delegation from the French, and at that time it was, a very complicated situation, but we keep in touch during the time, and finally we decided to prepare a young project with French, and that is a project that is going on. The project we started that last June. I go to it's basically the University of Strasbourg in France and Paris University both. And this project, I was there for a month with I am the coordinator of the project in Cuba, and Professor Eric Solo is the project coordinator in France. This idea that we are working is comparing what happened in Cuba and what happened in France in the response of the COVID, from the socioeconomic, socioeconomic point of view, what happened with the outcomes, what happened with the vaccine use, and what happens with the trains, the trains during the vaccine. It's a huge project. We are working here more than 20 people, biostatistics, mathematics, epidemiology, and people who are working with social science. It's a big project. Now we're working in the first article, but comparing is very difficult because the French health system is different, but we are trying to talk with this problem. And this is the idea. We are preparing a first article, and the first article is a general approach about the pandemic, how was the response of Cuba, but at the same time, the sociologists are working on what happens in both countries. The mathematics and epidemiology, they are working in the same country. There is another group. It's a small group, still a more group. It will be the biggest. Is working about the why. I think one thing I forget is economy. From the economic point of view, how much money you allocated compared with the. I am talking about the third group is talking about how to prepare the response with prognosis. In the future, what is going to happen with another outbreak that will be here with you, I mean in the world. And now it's included, finally, 2 days ago, Guadalupe. Guadalupe is a French territory in the Caribbean. They have a big problem at the beginning, and now, but in summary, we are working in all of hot points during the pandemic response, and the second is a 4-year project, and we are in the first year now, and in the third year, from now, we're working with this small group of mathematics, epidemiology, geographical information systems, because they have a good team there, and now we are working on that. It's one thing that we are doing in the international field. The project is approved for everyone, and we have a wonderful presentation there. And on the other hand, now we are trying to do the same that we did with 3 countries, but not now not with the incidence, the mortality, no. We are talking about what happened with the years lost because the COVID, the premature death, many things that is indicator. Let me say it's indicators of what happened in different countries that not in terms of incident, in terms of how the country left the pandemic, what left.
Okay. Well, thank you for that. We've got about 4 minutes. If you open your chat, Dr. Bermejo, there's a question there from Dr. Katia Bruxfort, who is an infectious disease epidemiologist here at UAB. And she's asking about the challenges of monitoring vaccine effectiveness and safety long term.
Very good question. So very good question. Well, you know, in Cuba, the health system is public, and we have all the statistics available. And when we are talking about statistics, are confident studies. And yes, we are doing these things. I had a meeting 3 days ago with the director of the Biotech Institute, with the people of the immunization campaign, and of course we are following adverse results, sorry, and what maybe not in short time, maybe in long time, what is will be happening or not during that. But this is a wonderful question, and I am shared with my colleagues here because he's and he's saying there is all complex and challenging in the U.S. We say U.S. and in other countries. The problem in the U.S. that you use a lot of vaccines, a lot of different types of vaccines, and now in Cuba we use the Cuban vaccine. But even though we are doing and we are following this, we have to follow the children. This is our idea now, to follow the children, but many things have to be done. And I fully agree that it's very important because I don't in the world that never used millions, trillions of doses of vaccines for thank you for the question.
Thank you. Thank you for your response to the question. So I want to again thank you, Pedro, for a wonderful seminar on the Cuban COVID vaccine experience, and want to thank you again for your time and for providing us with your insights. I look forward to the time when we can be together again, whether it's in Cuba or here in the United States. But thank you again for being with us on the webinar today, and thank you all for attending. I think that is it, and so we'll bring this webinar to a close. Thank you again.